Welcome back to our third annual Daoist Gate Conference, focused on Daoist medicine and healing, ancient Daoist wisdom, and its influence on modern Chinese medical treatment. We are so excited to be back here after two amazing talks this morning, which will be available on YouTube shortly after the event concludes. And we're going to jump right back into two more talks this afternoon. Our first speaker this afternoon came to a discipline of yoga therapy from a background in education and teaching. Valuing this education of the client and connection between their mind and body, her specialty is working with cancer and stroke survivors. While I was in conversation with Janet preparing for this conference, it became apparent that she's very passionate about learning to modify yoga and Qigong in order to make these practices accessible, to help people who are weakened focus more on what they can do rather than what they can't. Working with pretty severe illnesses in these cases, coming back into movement and connection with the body can be a big challenge, both physically and emotionally. But by allowing greater access to the full spectrum of yogic and Qigong practices, clients feel empowered to take charge of their own health along their road to recovery. Sharing her unique insight into the world of yoga therapy and its relationship to Qigong, here's Janet Liu.
Thanks, Sam, for that introduction. Let me share my screen. Just a second. Can you see that okay?
I'm not seeing anything.
Okay, yet. Hold on.
There we go.
How's that?
Yeah, and just a last reminder that we're taking questions in the chat box. So if you have a question during, please feel free to drop it in. We'll answer them afterwards. So take it away, Janet.
Arrange the screen. Hold on just a second. Well, thanks, Sam, for the introduction, and welcome to everyone joining in today. Today, I'll be talking about my experiences as a yoga therapist. I won't be talking too much about Daoist philosophy, as that's not really my area of expertise. But what I do hope to cover is a broad strokes introduction to yoga therapy and how it can support whole health and wellness. And I'll be touching a little bit on research and how yoga and Qigong fit into Western integrative health today, some of the similarities and challenges. Just to briefly touch on my background, like Sam said, I was a teacher for over 20 years, teaching music and art in K-12 grades in public and private schools. And I also worked a little bit in alternative education as well as in special education, working with kids on the autism spectrum. So I've kind of always gravitated towards kids with challenges, and this kind of work really revolves around small group settings as well as one-on-one work. So I really feel like this laid the foundation for what I do today as a yoga therapist. Yoga therapists tend to mainly work in small groups or one-on-one intensive sessions with clients. Aside from my classroom work, I've been a private piano teacher for a long time. And over the years, I've sort of seen a rise in overscheduled, overstressed kids. And I kind of say this anecdotally, but I really think our kids are just mirroring our adult population. And just to share a brief story, one of my 10-year-old piano students came in after school for lessons, and he was dragging his feet and he flopped down on the piano bench and was practically lying down on the piano bench. And if you're the piano teacher, you're thinking, oh boy, today's piano lesson is going to be super long. So, I said, are you okay? And he said, oh, I'm just so exhausted. And then proceeded to tell me about all the activities he had to do during the week. And I said, okay, well, let's stand up and let's just shake it off. So I had him just do some simple spinal twists and some just kind of shaking out the arms, somewhat similar to what we might do in a Qigong warm-up. And then I said, okay, sit down, put your feet flat on the floor, have a tall spine, and just close your eyes. Let's just focus on the breath for a few moments. And I led him through a very simple breath awareness practice, which I really wasn't trained to do at the time, but I was just sharing what I thought would intuitively help him. And then he opened his eyes and he said, wow, that's the best I've felt all week. And so I couldn't help laughing because this 10-year-old really sounded like a middle-aged old man. So from then on, I would kind of start to incorporate simple movements, stretches, breath work to really ground my students before jumping into piano lessons. And that's very similar to what I do today with my one-on-one clients, is to have that grounding and tuning into stillness, similar to what we might do in martial arts. We're very familiar with this practice. But my first personal experience with meditation was in an Aikido class, which I took for several years in college. There wasn't a lot of instruction. I just knew it was part of the practice, but it didn't really sink in that deeply. And this is also my first exposure to what Qi is, or in Japanese, Ki. And I remember we would do this partner exercise. And those of you who are into martial arts may be familiar with this or do something similar, but we'd kneel down on the floor together, and one person would extend one arm out slightly bent at the elbow. And the instruction was to feel the Qi running through your arm out through your fingertips. And then your partner would then proceed to try and bend your arm at the elbow. Now, if you were doing it right, they couldn't bend your arm. So, I just thought, okay, I don't really understand what this Qi is, but it seems to work. But it just landed sort of superficially. I just thought it was okay, a cool party trick. And I bring this up because I think about my clients today when I try and introduce a new concept or more subtle aspect of yoga, especially if they're new to yoga, that I have to be able to meet the client where they are. And that means being sensitive to who they are, what their history is, maybe how open they might be to certain concepts. And I have to be okay that sometimes these concepts may not land deeply at first, and it may take time to kind of level up, especially if I'm talking about moving prana or chi. And meditation is challenging, and it might not take right away. It's still challenging for me today. So just I think about this, and it's okay. Everyone has their own journey. I then practiced yoga for almost 20 years, but honestly, it was just about fitness. It was just about exercise, maybe a little vanity. But this collage I put together is pretty typical of what the Western yoga industry looks like. It's how they market yoga, sell yoga clothes, the yogic lifestyle. And it wasn't until I started taking yoga classes at yoga studios when I remember there was a very clear shift in how I felt in my body and my mind. And I don't know if it was because I had better teachers or teachers that emphasized more the subtle aspects of yoga, like meditation and breath work. Maybe I was just an older adult and suddenly everything started to click. But I remember I was taking Pilates classes on the reformer machines at the same time. And it was so clear to me that I didn't feel the same way after Pilates class as I did after a yoga class. And so this really was the moment that sparked my curiosity. I wanted to know, why was this working? What's the science behind it? And so I started studying. And then one day, one of my yoga teachers at the time said she was studying to become a yoga therapist. And that was the first time I've heard of it. And so then I started looking into what that was, and something about yoga therapy really spoke to me. And I thought, yes, this is what people need. And so this is really the time when I jumped into training to become a yoga therapist. During my yoga therapy program, I started working with a client recovering from stroke. And I had no idea how to work with somebody with stroke. In fact, it was a little scary to me at the time. And she was not only dealing with the stroke after effects, but she had multiple health conditions on top of that. So a slightly complicated case. So I knew I needed more training, and I really sought out for training specifically for neurological conditions. And I worked with this client for a year. And after that year, my father had a stroke. So suddenly it was very clear that the universe was preparing me for that moment, because otherwise I would have felt quite helpless. So here I was with my newly obtained yoga therapy toolbox, and I wanted to know how I could help my father, starting in the ICU room. And although it was, a traumatic experience, it was a very valuable one as well, because I was able to observe all the physical therapists, occupational therapists, speech language pathologists, and see how they work with patients going through stroke. But I was also able to see the gap in services. This quote here is from another client of mine who survived a stroke. And he really highlights here how everyone was there to take care of his physical body, but no one there to take care of his emotional, mental, emotional state, which is so important in keeping that motivation up right away so you can get onto that rehabilitative road, which is so important with stroke. So for the past few years, I've mainly been working with stroke as well as cancer thrivers. And cancer also hits really personally to me. I've had about 9 family members touched by cancer. So I've seen that journey firsthand. I understand the challenges that are involved. And more recently, I've been hired to teach yoga therapy classes at a large cancer hospital based in Southern California. So I'm really excited to jump into that and really understand what it means to work within integrative health. So what is yoga therapy? This definition I took from the International Association of Yoga Therapists, I-AYT. This is a nonprofit governing body that credentials yoga therapists as well as accreditates yoga therapy schools. And their definition is yoga therapy is the process of empowering individuals to progress toward improved health and well-being through the application of the teachings and practices of yoga. I really want to highlight this word empowering, because so often when someone's first diagnosed, they feel disempowered right away. There's a lot of people making decisions about your body and making appointments for you, and it can be quite overwhelming. And I think Andrea had talked about this as well. But I think it's really important that individuals feel empowered and are able to make choices for themselves during this process of coming into a state of whole health. This is just a more detailed definition of yoga therapy from the Desikachars. I just wanted to highlight a few of these phrases. So again, self-empowering process, addressing the illness in a multidimensional manner, and facilitating healing in the person at all levels. So very holistic practice, very individualized. Now you may ask, well, isn't all yoga therapeutic? Yoga is supposed to be good for you, right? And there's a lot of research pointing to the benefits of yoga. And maybe your doctor even has told you, hey, you should try yoga. But let's say you have a specific health condition and your doctor says that to you. So you go and seek out a yoga class at your local gym. Well, the teacher may not know that you have a medical condition, first of all, but even if you told them, they may not know what to do with that information. And, all of us want to be the good student. We want to follow the teacher exactly. We want to look like the teacher, and we don't want to stand out in class. So, but unfortunately, that teacher may be offering you practices that are contraindicated for your particular health condition. So therefore could potentially be dangerous. I once had a yoga teacher that was super gung-ho about headstands. And she'd say things like, hey, you look healthy. You should be able to do a headstand. And it didn't matter if you were a longtime student or someone who just walked in for their first time that day. She'd say the same thing and then proceed to put them up into a headstand, which at the time I thought, that looks a little bit dangerous, because you cannot look at a person and know that they have issues with glaucoma, high blood pressure, cardiac issues, or arthritis. So just know that a yoga therapist is trained to work with multiple health conditions, both physical and mental. However, we do not diagnose. We're not a licensed health professional yet. And we are not psychotherapists. We are not physical therapists, even though many elements of our practice may look similar. This is a slide I'm borrowing from I-AYT, just so you can clearly see the differences in training between a yoga teacher and a yoga therapist. So we both have training in yoga philosophy and foundations, basic anatomy, physiology. We know how to teach. In addition, yoga therapists have training in psychology, some biomedicine. We know how to adapt yoga to the individual, We may have in-depth anatomy and pathophysiology knowledge, as well as extensive clinical practicum work. So for myself, I've actively also sought out additional training outside of my yoga therapy program, just because of the area that I specifically wanted to work in. So yoga for seniors and arthritis, more training specifically in cancer and neurological conditions. So it's really about finding your niche and then finding the experts out there to continue learning from. These are just some places where yoga therapists currently can be found. The VA, Veteran Affairs, has invested a lot of funds toward providing yoga for veterans, and they're doing a lot of good work there. They may be working in integrative health clinics or on a healthcare team, in hospitals, teaching small groups, one-on-one work, bedside yoga, and then mental health practices. There are a lot of psychotherapists using yoga or have a yoga therapy background. So they've really, understand the benefits of working with not just the mind, but the body. And finally, private practice. What a yoga therapist really looks at are the 5 koshas, or the panchamaya koshas, or the 5 layers of a person's being. And you can kind of visualize this as layers of an onion. So starting on the outer layer, the physical body, on annamaya kosha, moving into the energetic body, pranamaya kosha, then the mental emotional body, manomaya kosha, the wisdom knowledge body, vijnanamaya kosha, and finally the bliss body, anandamaya kosha. And this might be where spirituality is somebody's spiritual center kind of lies. And the yoga therapist uses these as a lens to first understand the client, then see where there might be imbalances, and then provide tools that address each interconnected layer. This could probably be a whole lecture just on this slide, but I just wanted to briefly touch on this. But if you're working in a Western medical facility, you probably won't be using Sanskrit words. So just know that this is somewhat similar to the Western concept of the biopsychosocial, emotional, spiritual model. These are just some tools in the yoga therapist toolbox, starting with asana, or the poses, postures, movements. And this is really what Western yoga really understands yoga to be about. But we also have pranayama, so the energetic work, working with the breath, raising the energy up, bringing the energy down, just directing the energy in a certain way. Then there's meditation that might include guided visualization or yoga nidra, mindfulness meditation, and there's just many different kinds. And what's fascinating is different types of meditation light up different parts of the brain, which is kind of interesting working with people with neurological conditions. I might introduce hand mudras, or which are just hand gestures, or mantras, which are short phrases, affirmations. And these are just tools to really just focus the mind. And I might use this in conjunction with meditation or with pranayama. There's a fair degree of creativity that a yoga therapist can have in combining the right tools to meet the person in front of them. Svadhyaya just means self-study, so I might recommend journaling or reading particular books. And then finally, lifestyle recommendations. So that's looking at how people eat, sleep, have relationships. And most yoga therapists have some training in Ayurveda, but similar to traditional Chinese medicine, you need many more years to really call yourself a practitioner. But there are some yoga therapists who really have that in-depth training. So this is kind of that category. What does a yoga therapy session look like? So if we're talking about a one-on-one session, I would have the client first fill out a very detailed intake form outlining their health issues, medications, concerns, and goals. But it's really during our first meeting, during the intake and assessment session, which usually is the longest session, where I'm doing most of the information gathering. So I'll have the form in front of me, and I'll be able to ask more in-depth questions. And really my goal is to paint a more complete picture of who this person is three-dimensionally. Sometimes this is this may be the client's very first time verbalizing about their medical condition or issue. And so just having someone there to listen to you can be incredibly healing. This first session may also include a movement and postural assessment, a little similar to maybe what an exercise specialist or PT would be looking at. And then I'd also be noting their energetic levels. So using my eyes and ears to look at this person. Is this person a hard driving nonstop person or someone with low energy that might need more support with motivation, and seeing if there are imbalances there. Together, we clarify goals. So making it realistic and doable for our time together. And it could be something as simple as, I just want to play golf again, or I want to be able to sit on the floor and play with my grandchildren, something like that. So once we establish the goal, we then can co-create the yoga therapy plan. And it might be 3 or 5 yoga tools. And I say co-create because it's really important that this plan fit this person's lifestyle and they're able to do it on their own and integrate it into their life. And this is often the hardest part. Adults have 0 time. So some people will say, oh, I can do a whole hour session practice every day, but usually they're people who, have had a yogic practice before, so no problem. But most people have 0 time to practice. So maybe it's introducing a couple things they can do in the kitchen while waiting for the rice to cook, or a couple things they can do upon waking up that they can do in bed, or a couple things right before bed. So making it simple and doable. And then during the session, I would teach the plan, help them, feel the benefits, and then the follow-up sessions, I check in with them. Hey, how are you doing? Has there been any changes? Did you do the practice? Well, why or why not? And then we go through the plan again and do it together. And maybe I would revise it or adjust. Maybe I'd add on another layer. And so depending on how long a client is with me over time, their goals may change and shift, and that's completely normal. So just to give a simple example of like a generalized client might be the weekend warrior, and maybe some of you can identify with this. But the weekend warrior is someone who works long hours during the week. They have 0 time for exercise, 0 time for any self-care. And then Saturday rolls around and they say, I got to make up for it. I'm going to join a marathon, or I'm going to join that intensive Tai Chi workshop. And then they end up hurting themselves or awakening some chronic pain. Now I could help them address the physical symptoms, but that's probably better served by a PT or other doctor. But if they've already done that, it's no longer acute, then I can help them with the physical symptoms. But more importantly, if the client is open, I could help the client look at their lifestyle, help them to see patterns, habits, underlying reasons for overworking and putting off self-care during the week. What is the reason for overdoing it on the weekend? Or are they just trying to find external validation by working harder during the week? So it can become a journey then to really find the root of the issue, even though it's presenting as a physical one. A more complicated case may be someone who is diagnosed with cancer. So on the intake form, they'll indicate what type of cancer, what kind of treatment, surgeries they're going through, what kind of medications they're taking, what kind of symptoms they're experiencing. And there's always a question on their emotional state. So they might say, I'm depressed, anxious, worried, all normal, all expected on the cancer journey. And then I can do my detective works, especially if there are medications or treatments I'm not as familiar with. I can research it or ask colleagues in the field. Now, what might further complicate an already complicated case is when the cancer patient comes to me during our first intake session. And what I hear is that the client is talking mainly about some trauma that occurred from before their diagnosis. So that's kind of like a red flag. Like the trauma is primary and the cancer side effects, et cetera, is almost secondary. So of course, if it's very serious, I would refer them out to the appropriate mental health professionals. If they're already doing that and they come to me and they say, hey, I just would like to reconnect with my body, then I can help them, reconnect the body with the mind, softening the trauma first before helping improve any quality of life issues due to cancer. So you can see that this can be could be complicated, and two clients with the same diagnosis may look very different. So the way I see it, a common thread underlying it all, no matter the diagnosis or the condition, and I'm not talking about the very serious mental health conditions that exist, but kind of as a visual metaphor of what I have observed in my limited experience, is that people tend to keep a locked room in the attic of their minds. And in that room, they like to shove pain, resentment, fear, unresolved issues, any uncomfortable feelings. They just shove it in and lock it. And sometimes people don't even realize that this is their habit of doing this. They're really good at avoiding, distracting, ignoring, until things start to spill out of that room and start affecting their mind, their body, and then their lives. So I see my role as someone that can gently lead someone by the hand to that door so that they can unlock it themselves. And then only then can consciousness and self-awareness be awakened. They can start cleaning out that room, sweeping the floor, opening the windows. And really, that's when they can clearly see and look at their lifestyles, how they eat, sleep, work, have relationships. How do they find joy in life? And what keeps them going amidst life's challenges? So my goal as a yoga therapist is not to fix someone, because the philosophy of yoga is that we're already whole. We just need to be reminded. This is a yoga suture that should be familiar to every yoga student out there. Yoga Chitta Vritti Nirodha, which just means yoga is removing the fluctuations of the mind. So notice it doesn't say yoga is exercising the body. It's removing the fluctuations of the mind, because most of our suffering is often caused by our mind, our desires, aversions, attachments, ignorance, and especially our ego. We're always trying to protect our ego. So shifting into integrative health, and they often talk about whole person health. And this is a definition I pulled from the National Center for Complementary and Integrative Health. And I'm mainly speaking from a very US-centric point of view. So this integrative health may look differently in another country, but their definition is whole person health refers to helping individuals, families, communities, and populations improve and restore their health in multiple interconnected domains: biological, behavioral, social, environmental, rather than just treating disease. Eastern medicine and Eastern mind body modalities have already been doing this for a long time. This visual graphic is I pulled from the same place, and this is just how they categorize complementary health approaches under the categories of psychological, physical, and nutritional. And you can see where yoga and Tai Chi lie. Notice there's no Qigong. But what I always find interesting is how mindfulness and spiritual practices, meditation, breathing, and relaxation techniques are often separated out from yoga, Tai Chi, Qigong. And there are many reasons for this. Larson kind of talked about this a little bit earlier. But those of us who are practitioners of these modalities know very well that these are all important parts of our practice. I have some colleagues who work in integrative health, either as a yoga therapist or a PT with a yoga background, or other medical professional with a yoga background. And they provide yoga practices within their hospital or medical facility, but they don't call it yoga. And one of the reasons they said was because they say, oh, if we call it yoga, it's going to turn off a lot of people. And I can understand that. This slide I showed earlier of yoga as fitness, if you're in your 80s and you have multiple health conditions and someone tells you to try yoga and you have that image in your head, of course you're going to be like, no, no, yoga's not for me. I'm not young. I'm not flexible. Uh, so I understand the reasoning for not using the word yoga. However, a con, I think, is by not calling what it is, we're not doing anything to push our fields forward, whether that's yoga, yoga therapy, Qigong, Tai Chi Chuan, we have to, part of this is educating people to understand that these modalities are more than a physical practice, that we have these other more complex elements that we use as a whole. So I'd like to take one step deeper into what integrative health might look like in a particular pathology. And I just chose integrative oncology because that's sort of the area I work in. And this is the definition of what integrative oncology is. And I just wanted to highlight a few phrases here. So patient-centered, evidence-informed, utilizes mind-body practices, natural products, and/or lifestyle modifications, aims to optimize health, quality of life, and clinical outcomes. So these words, evidence-informed and clinical outcomes, really highlight how important research is, especially when working within the Western medical community. We have to be able to speak their language. And also, it helps inform how we educate people about Eastern healing practices. This is just one research study I pulled that did a review of the current literature, specifically looking at yoga and cancer. And they just highlight that yoga is increasingly recognized as a complementary approach to cancer symptom management. So we're complementary, we're not alternative, we're complementary or integrative. And I just highlighted some of the benefits that they highlighted in the study, that yoga helps to improve overall quality of life, in particular fatigue, which is very common on the cancer journey, may improve stress, inflammation, immune functions, may improve sleep and cognition. So just a few of the benefits. But you can look up a lot more research out there on other mind-body interventions, including Tai Chi and Qigong. You could look them up on PubMed, medical journals, and I just pulled out a few studies specifically looking at these mind-body interventions and cancer. This is pretty recent information. This was a guideline published in the Journal of Clinical Oncology. It was published last week. What it is that the Society of Integrative Oncology and the American Society of Clinical Oncology formally recommend mindfulness-based interventions and other integrative therapies to specifically manage anxiety and depression in adults living with cancer. And what they did was they had a panel of experts pulled from different divisions in oncology, and they looked at the research from 1990 through 2023, including systematic reviews, meta-analysis, and randomized controlled trials. And they graded them high quality, low quality, and then based their recommendations on how they graded it. So this chart is just looking specifically at anxiety symptoms. And you can see for active treatment, they recommend yoga for breast cancer as well as other cancers. For post-treatment, they recommend yoga, but also acupuncture and Tai Chi Qigong. Now you might ask, well, how come Tai Chi Qigong acupuncture is not here for active treatment? Just because it's not there doesn't mean it's not effective. It just means for this particular guideline, there either wasn't enough research, or the research that does exist wasn't of as high quality and therefore couldn't be recommended. And that may change in the future. I hope it does. This chart is specifically looking at depression symptoms in people living with cancer. So active treatment, again, yoga is recommended. For post-treatment, you have yoga, Tai Chi, Qigong. And the whole purpose of this guideline was really to provide an evidence-based recommendations to healthcare providers on these integrative approaches. So I think, we're moving in the right direction. I think there's a lot more work to be done. And finally, this study was just comparing yoga and Qigong and pointing out some of the similarities. Even though and also how they've both been used for similar health conditions, even though more research has been conducted on yoga in comparison to Qigong. What was interesting in the study was that for yoga, most trials have been conducted on relatively younger healthy participants across India and the United States, while for Qigong, most trials have been conducted with relatively older, ill people in China and the United States. Also interesting to note are the gender differences. So in the US, yoga practitioners tend to be white, female, young, and college educated. In Australia, both yoga and Qigong are dominated by women, although Qigong had a stronger appeal to men. And finally, in India, yoga practitioners are more likely to be men aged 21 to 44 and high school educated. So I started studying Qigong a few years ago just for my own personal interests. But when I started working with people with limited mobility, I realized it was harder for them to experience flow in the physical practice of yoga. So I started to incorporate and integrate pieces of Qigong into my one-on-one work, which I know isn't really new. There's a lot of people integrating yoga and Qigong. But what I found that my clients gravitated to was this experience, this different experience. And maybe because Qigong was more novel to them. But I also felt they enjoyed the more visual, expressive aspects of the physical movement. They were able to experience flow. Some of the simple movements challenges the body in a more 360-degree way, the twisting and turning of the body, the sustained movement of energy throughout the body. Also the expressiveness, the dance-like quality that moves the body in a slightly different way from yoga. So for trainings for general yoga and yoga therapy, there are many trainings for specific health conditions and illnesses. We learn how to offer options for poses. We learn which poses, breath work, specific yoga practices are contraindicated. We learn more in depth about specific health conditions, for example, cancer, the different types of cancer, treatments, etc. Because patient safety is really our number one concern. And I would love to eventually see a similar level of resources for Qigong and Tai Chi Chuan. What I managed to do is attend many Qigong and Tai Chi classes offered through hospitals throughout the US. And what I found was that it's quite varied. Obviously, I know there's many forms, lineages, focus, but I've seen that it's ranged from more external physical practice to a more internal meditative approach. And some instructors teach forms exactly as their master teacher taught them without offering any options for people with various health conditions. So this may be an important point to look at, especially when the Western medical community often advertises Qigong and Tai Chi as safe practices. However, the question we should always be asking is, are all practices appropriate? And are we okay sacrificing form for safety? Now, I don't really have an answer for this, but I just want to leave this for here as food for thought, especially for those of you who are already working in the field or are teaching, because you will likely have people with medical issues in your class. So in closing, I would like to just say that integrative health is becoming more accepted as a vital part of Western medicine, which means that Eastern mind-body practices such as yoga and Qigong are becoming more accepted. So it's a really exciting time for yoga therapy as well as for Qigong and Tai Chi Chuan. You know, we just need more research to keep moving the needle forward, and we need to keep educating people about our modalities, and hopefully our modalities can support each other in order to offer more people access to our services. And I put this character Yi for intention to really highlight our intention as our modalities continue to integrate with Western medicine. You know, how do we maintain the benefits of Eastern mind-body practices that looks at the whole person versus becoming more like the reductionist Western medical approach of looking at just the disease and treating the symptom. So hopefully we can maintain our intention to preserve what makes us special and effective in helping people reduce suffering. So thank you so much for your time. I'm really humbled to be here and speak about this topic, which I'm really excited about. If you want to reach me, or if you think of some questions later on, we'll still have a Q&A today, but if you have questions later on, you can reach me via my website at www.alohayogatherapy.net. If you'd like more general information about yoga therapy, go to yogatherapy.health. And I'm going to throw it over to Sam. So if you have any questions, feel free to add it in the chat.
Thank you, Janet, for your talk. Let's get into some Q&A right away. We have a couple really cool questions to address. The first one is from Andrea. Could you maybe give an example of how you would diagnose with the koshas? I have read about them, but don't work with them.
So again, we don't diagnose per se, but we are using the koshas as a lens. So for example, someone might present more on the kind of the physical. Usually people come in with more of the physical, but and it may not be right away. It may take, this is slow medicine, so it may take some time to have them come to a realization that maybe it's actually just a mental emotional issue that has a direct link to the physical. So it can be quite complex, and it's, like I said, it's really individual. It looks different for every client. And so it's really mainly, and it's not to say that one layer is better than the other. It's really, I mean, they work interconnected in an interconnected fashion. One affects the other. So it's about sort of finding balance within each of those levels. You know, eventually hoping that somehow they move towards this more, hesitate to say spiritual center, but when I say spiritual, it could mean anything from belief in a higher power to finding a purpose in life, right? So, and you know, finding that thing that grounds them, and which affects all of these other layers. I hope that kind of answers your question.
All right, great. So let's move on to Bill's question. Thank you for the excellent talk. Empowerment is definitely the missing ingredient for many people seeking treatment. How many of your clients go on to study yoga or even yoga therapy after they've worked with, after they've experienced?
You know, I don't have the answer to that, but you know, I would hope that when they leave me, they still keep some of these yogic practices, even if it's not the physical movement. But you know, part of the process is teaching people that they can incorporate simple tools into their lives. And you know, I think if people experience the benefits, then they're more likely to be motivated to keep doing it. But yeah, I can't say for sure exactly how many of my clients have really stuck with it. But you know, again, that's a person's choice, right?
Totally. Yeah. So the last question we have in our chat box right now is, how do you as a practitioner navigate the space of integration in terms of integrative healthcare, in terms of adjusting yoga for the setting that you're in, while being mindful of appropriation?
Oh, that's a good question. Yeah, there's a lot of talk revolving around appropriation, definitely. You know, I think it's being intentional with what, you know, the direction you're going towards and what you're offering people. And, you know, definitely yoga therapy as a whole does have more of that bent towards, you know, the medical world, health issues, you know. Um, so really it's, you know, yeah, I mean, if you look at the history of yoga, not to go into much detail, but it originally was a one-on-one interaction between teacher and student. So I think in some ways we still are trying to bring that back a bit in the practice. Although, yes, part of it is being able to learn to work within the medical community. I think that's important too. So I don't know if I have the exact answer for that, but for me, it's just looking at the individual that's in front of me, and you know, it looks so different from client to client. I can't even, you know, start to say it's this one way or something. So yeah, I'm hopefully I kind of answered that question.
Yeah, I mean, we're bringing up questions, right? Like Larson's talk, right before us. You're talking about even the history of Qigong and how some of these practices were practiced historically with a spiritual lens, and then brought into modern times with a, hey, this is good for your health sort of
Mm,
lens, or this is something you could do an hour a day, whereas it may root in practices that took a lifestyle change, a complete shift. So
mm,
yeah, I think that's something that I would put to everyone who's watching the conference is when, because we're talking about Chinese medicine, or in this case yoga therapy. It is really important to look at like what we gain and what we lose when we adapt, and understanding a bit of when that's appropriate and when that's not. So we don't have the answers today, but thank you, Rob, for that question. Uh, if there's anything else anybody has to say, definitely drop it in the chat. But otherwise, we're coming up on time here. And so we'll have a little break, and then we'll come back at, let me make sure that I'm getting the time right so I'm not misdirecting anybody. It's going to be 2:15 East Coast time. So you can translate that into wherever you are in the world. So thank you, Janet, for being here.
thank you
And
so much.
yeah, we'll see you soon.